So the normal age for menopause is around about 48 to 53. It is different for different women. So some women go through the menopause a little bit earlier and have early menopause, and some women have their fertility that prolongs a little bit longer and having periods up until 54, 55. That's much, much less common. But the rough average age is around about your 50s, and it's usually quite similar to what your mum or older sister might have had. So there are a multitude of symptoms for menopause. The ones that everyone knows about are hot flushes. That's the most common, where you feel like a hot wave come through your body. It lasts for a few seconds to minutes, and it can make you feel very sweaty, very red, very flushed, and very, very uncomfortable. The less common side effects are having brain fog, which is a lack of concentration, difficulty sleeping, feeling that your mood swings about a lot and you're not being able to be in control of your emotions, having lots of aches and pains in your joints that are different to what you used to have a couple of years ago, having change in the way your body looks. So obviously, as your estrogen depletes, your hair, your skin, your fat deposits all change, and those also can be signs of the menopause. Erratic bleeding towards the end of the menopause is also very, very common. There is a wide range of symptoms, so it's always worth having a chat with the doctor about those things. So GP is a perfect place for your first consultation about your menopause when you're not sure what's going on, and to make sure that that is the reason why you're having those symptoms, that it is the menopause. So sometimes there are other medical reasons for the symptoms that you're having, and it's worth your GP ruling out other medical causes. And if we are sure that it is the menopause, then there is a range of treatments that can be given, either specific to those symptoms or generally as hormone replacement therapy for the whole menopause. There are also lots of other targeted treatments, for stuff like libido, for your mood, for aches and pains that are targeted for women of menopausal age. So have a chat with your GP. There are loads of options. You shouldn't suffer alone. So talking to a GP about menopause should be as straightforward as booking an appointment, but I do know that some patients find it very difficult. It is quite a private conversation, and some GPs, especially sometimes our male colleagues, can find it a bit of a difficult conversation because it's so intimate. So find a GP that you are most comfortable with, that you can be very open and honest with, and have a dynamic conversation, because it's a two-way street. There is so much treatment out there, but it has to be the right treatment for you that's very specific to your particular problems. So try to have an open conversation with a GP that you trust the most. Yes, so I would expect you to get your hormone replacement therapy from your GP at the first point of call. Sometimes in very, very complex cases, you do need to see a specialist like a gynecologist, or sometimes a menopausal specialist GP. But I would expect 85 to 95% of the population, your GP is your first port of call and can start hormone replacement treatment immediately. So the majority of the time, we do not need to refer to an endocrinologist. This is a female-based issue. So a gynecologist is a specialist that you would go to if needs be. But the majority of the time, the GP is well within their speciality to be able to treat with hormone replacement. The only time you'd really involve an endocrinologist is if there is something very peculiar about the symptoms.